In December 1999, when most people were off on their summer holidays, Drs. Hendrik Hanekom and George Viliotis were crafting a business plan that will continue the transformation of the private healthcare industry in South Africa. The two men, who had been colleagues at the South African Medical Association a few years earlier, were confronted by a number of challenges and opportunities, especially advances in medical science, the increasing frequency of chronic disease, and skyrocketing healthcare costs. At nearly the same time, a PwC report showed the need for improved customer service in the healthcare industry, while group practices, subacute hospitals, and day surgery were growing overseas. After securing a major backer, Hendrik and George began the tough task of building Intercare from the ground up. Today, it's one of the fastest growing healthcare groups in the country and is the only one covering medical and dental centers in the primary healthcare space, as well as subacute hospitals and day surgery hospitals. In 2002, the first Intercare Medical and Dental Center was opened in the eastern suburbs of Pretoria. At Landfair, customers were able to access a wide range of healthcare service providers under one roof.
Our whole organization was built around the customer. The customer wants healthcare their way, and that is how Intercare was formed, to really provide the customer healthcare that they like.
Healthcare is a specialized business which needs expertise in managing healthcare. What has differentiated us at Intercare is that we've been very creative, very innovative, and very adaptable to the local environment.
I've been coming here for 10 years now, and the reason why is they give such a comprehensive service to the public under one roof.
We're a diverse group of clinicians here, each with their own expertise and niche fields, so it's always great to have that kind of support. In the end, it's about your efficient patient care.
Conveniently open from early to late and over weekends, it didn't take long for the business to take off. Today, Intercare's impressive nationwide network of medical and dental centers services the healthcare needs of more than 600,000 customers a year.
The second month when we opened here, we saw 2,436 patients. And now after 10 years, August the previous month, we saw 5,987 patients. So we're growing at an enormous pace.
In 2006, the first Intercare subacute hospital was opened in Tiger Valley in the Western Cape, primarily to address the revolving door syndrome being experienced in the acute care space. Once again, Intercare changed the playing field and defined a unique approach which was well received by the medical fraternity as a whole. In the following years, Intercare opened another subacute hospital in the Western Cape, and in 2012, the company opened a third subacute hospital and a world-class day surgery hospital in Pretoria East. The move, which is aligned with global trends, is likely to emerge as an equally compelling offer in the future.
There are many players also involved in healthcare. There are groups specializing in primary healthcare. There are groups specializing in hospitals. There are groups specializing in day hospitals, and yes, there are people who also have subacute and rehab hospitals. But we are the only group who have both the primary care division as well as the subacute rehab division as well as day hospitals. And I really believe the combination of those three elements makes us truly unique in South Africa.
Obviously, we've put in some great systems, and we continue to enhance our systems. Especially, I think, in terms of our IT, we can deliver much more than what a private practitioner will have single-handedly. I think also if you have a look in the medical aid industry and how things changes, we take all that hassle and bustle out of a doctor's life. So for us, the doctor can focus on the clinical work, while we in operations focus on make everything else working for them.
Growing Intercare is a priority, and plans are in place to develop the business in Europe, where many healthcare challenges are being experienced and there are huge opportunities for the model.
Europe is a good opportunity for Intercare because the populations in Europe are getting older. The need for good health services are growing. Governments are under pressure because of the economic crisis and are trying to reduce the involvement in healthcare, and this opens the way for the private sector to grow, and the Intercare model is ideally suited for that environment.
The need for preventing and managing chronic disease is also growing at alarming rates. To address this issue, the Intercare Center for Lifestyle Management is being rolled out at key facilities around the country. Nelson Mandela once said, "After climbing a great hill, one only finds that there are many more hills to climb."
There were many challenges. Starting as a business, we had to convince people about the model. It was new. I remember the first time we tried to open an Intercare in a shopping center. The owner of the shopping center said to me, "I don't need sick people in my shopping center." Today, they want us.
In the words of Apple's iconic Steve Jobs, innovation distinguishes between a leader and a follower, and the leaders of Intercare have always found a way. For Hendrik and George, family and faith are the ties that bind. Together, they provide a strong platform for success that embraces the power of possibility in a world of change.
It's wonderful to be part of Intercare. The main thing of Intercare is we're a family, a trusted family, and everyone here is involved with each other. And all the doctors here trust each other. And it's nice to work in an environment where you don't have to worry about all the admin and the financial part. You only can concentrate on your patients. The rest is done by other people.
I think my happiest memories of Intercare are about the people. I've worked with wonderful people in the branch as a manager. We had wonderful staff, wonderful health professionals. Working with Hendrik was always just amazing. And that was truly incredible. So the people, yes, I think Intercare to me is people.
I do want to commend and congratulate once again the Intercare leadership team. You have taken a very great, bold step, and Discovery is quite keen to support the initiative, and we will do whatever it takes to make sure that this initiative it gets where it needs to, and we are really truly hoping for more such initiatives. So, Dr. Hanekom, Discovery is ready to do business with you.
We believe that an integrated health system, which does not distinguish between public and private, is the way to go to deal with the issue of fragmentation in the health system. And we believe that we can work with the organizations like Intercare, whose focus is to ensure increased access as well as better care for patients.
I love working here, and from where I started up until now, I'm grown. All the training that they took me to and everything that I've learned from that training, it really grew me to who I am today.
And then lastly, on a personal note, for me as a Christian, you know, we've been blessed abundantly, and for that I have to thank the Lord.
Take a walk through any Intercare facility, anywhere, and you'll experience care, humility, kindness, and warmth. When people are vulnerable and weak, there's comfort and strength in belonging to the Intercare family. According to Theodore Roosevelt, nobody cares how much you know until they know how much you care.
I like coming here because it's a friendly atmosphere and you feel safe. And you know you're going to get the real attention you need for your problem.
At Intercare, delivering the promise of a better healthcare experience altogether lives and breathes in the hundreds of healthcare professionals who work here. They are the real success story. They are the heart and soul of Intercare.